speaker, Professor Lee Liming from Brazil, and his topic is training and employment.
Thank you, Ding, Graham. Thank you, Jacob, Michelle, Carol, for paving the road for my presentation. I think all the three speakers tied all well together, and I believe what I'm talking now will contribute to kind of blend on this topic. Well, I will start by thank you, the organizing committee, for inviting me here. Ask for a declaration and declare that I'm having a great time being in Thailand. Fantastic, I would say. You can see a little bit of the picture down there. I even tried to pilot one of the tuk-tuk taxi. Well, let's go to the work. We have a parallel session with the Wikipedia, which now I acknowledge their good work. I think it's a great partnership. And I will start by taking few consideration of the title that I've been invited to do about training. Training, that is the teaching or developing oneself and other skills or knowledge that it will be useful, the competence. Okay, but the good point that I would like to stress is this one, is that it used to be in the past that you only go to school once. No, nowadays, there's no once. It's ongoing. It's what they call professional development. So forget about that. You will never study again. So beware that nowadays this is the default mode. Why is that? Because in the past, for our knowledge in advance, it would take 50, 100 years. Now knowledge increases exponentially in hours. So it's very believable that what you learn in your school days at the end, you probably have to go back to the bench to learn it again in the right way. And that's what's been happening. So training is the point that I would like you to take a note. As for employment, I think in employment it says there is a relationship between two parties. When we talk about relationship, isn't that interesting? That is based on a contract. We have a lot of relationships, good and bad ones. And employment, I think we would like to take a note on this point of the talk. But somebody can say about, what about a job? Yeah, a job is nice. Job or occupation that you have employment within the job occupation. Let's say that the formal employment that is set around the world take about 40%. Most of the work done, carried out by people across the globe is informal. So there's a huge difference between employment and job occupation. But job occupation has a particular point that I want you to take notice. That is the patient's role in the society. So we kind of were brought up as a kid that you have to be this and that, etc. And okay, you have to get a good employment, go to the school, and you have to know your role. So I ask you, do you know your role in the society here, everybody? No? Totally quiet, while the people are sleeping or they are kind of thinking. But nevertheless, what happens? Then epilepsy showed up. Hold up, what now? Is that? That's the point. So I used to have a role that I was continuing to do. But now, then epilepsy appeared. So what I'm supposed to do now, should I go for my role that I had planned or not? Yes, 2 days ago, I was in this meeting. Mary was the chair, and Shanaz, a young, bright Indian girl, she presented her case, and her slide said that most patients deal with fear, anxiety, and acceptance that never show up, and awareness. And she described herself before epilepsy as a young, free mind, free spirit person that wanted to be a civil engineer, but then came up the epilepsy and obliterate everything of that. Her story is very common, unfortunately, to a lot of people with epilepsy. And can we just sit down and keep watching this contemplation? But I think the good point is that yesterday we have this launch of the WHO live IB Global Report on Epilepsy. A new Bible came up. I used to have Angles as a Bible for epilepsy, that is epilepsy surgery. And now the new guy on the block showed up, that is the public health imperative. For those that didn't have a chance to get a book, perhaps Mary can show us later on, I even got my autograph by a couple of people,
Good for you.
And I took already as Mary said, well, you have to use it somehow, not as a support for cup, but you have to read and take advantage of the content of the book. So I took the content, and I would like to share with you the chapter 5, the social response, misconception, and stigma in epilepsy, page 74. And then it said about systematic review about employment. That lower employment status may be related to felt stigma. Okay, felt stigma. But also later on he said inactive stigma and also unfair treatment. What are all those things? Well, inactive stigma is actually discrimination, pure and simple. People discriminate. Unfair treatment, you are not treated. But felt stigma is a point that is related to shame, embarrassment, or disgrace of having epilepsy, or the fear of being discriminated against. So, where is this problem? It's within the person with epilepsy. So I would like to take a note from this as well. I would go. But what about, let's say, the employment, the job, the training? Now, we probably heard that the robots are coming. Okay, they are here. So, are you going to go for the same path as your parents? You're going to be jobless. Sorry to say that. And so what can we do? Well, it's nice. There's this inside report that I just dig out. Internet is fantastic. You can find a lot of interesting things. That thing also is that. The Future of Jobs Report 2019 is very fresh. It's from the World Economic Forum. And it's a lot. And what I try to do is just pick up a few things, but you're going to see a lot of graphics inside. And it sounds very scientific. But I want to take, for instance, Thailand. I want to honor the country who is having us here by having showed the emerging job roles and emerging skills. Okay, let's amplify that. Emerging job roles here for the 2030 in Thailand. If you want to have a job here, you have to have a look on those type of jobs that probably is coming around. But the skills that you have is there on the bottom. So it's an analytic thinking, innovation, active learning, complex problem solving, critical thinking, analysis, system analysis, evaluation, reasoning, problem solving, emotional intelligence. Okay, but this is not the same for other countries. Let's take, for instance, down under. Honoring Graham and Jacob here, and other Aussie here. Then the emerging job in Australia here. But I want to come to the emerging skills. It's pretty much same to the Thai, but there's some difference. If you take on the right side, or my left side here, leadership and social influence, emotional intelligence, reasoning, problem-solving, ideation, resilience, Jacob, resilience, stress tolerance, and flexibility. I would like somebody that is writing something to write down resilience, stress tolerance, and flexibility. Thank you. But what about, okay, so can we do something actually? No, we know this, but something we can do. Well, here's Mary Sick again. She came yesterday, no, we have to do something. Action is needed to defeat epilepsy. Okay? We need to defeat epilepsy. But not only with words, we need to have a plan, we have to action. So, of course, it's not simple. It's not one silver bullet that will kill this beast. We have to have a multi-type of approach. So there's a scheme that is being laid out in this new Bible, Epilepsy, that considers society level, individual level, health system level. That individual level talks more about access to medical care, health care, and adherence to drug treatment, and support from the society. But I would like to share with you something that we are doing there in Brazil that is related to something you probably seen, feel, and suffer, that is social death. We know that treatment can prevent SUDEP, but nothing has done to prevent social death. Social death is something that is very predicted. You know that's going to happen. That is progressive, lingering, and at the end of many years, the people end up dying society-wise. I think there's worse thing than death itself. So one of the things that, as I'm working in the comprehensive tertiary center, we take the patient down the road with all the psychological problems that patient have, and it's very hard for you to kind of change the mindset. So the way to do that is that we have to take when they are diagnosed. And as Carol said, they are more prone to listen. But we understand that not only knowledge that is important, we have to do something that we can provide a mindset change. So what we did is we took a multi-professional approach. We got people from different fields of knowledge, cognitive behavioral psychology, positive psychology, traditional Chinese medicine, mandala for emotion is a particular type of approach that is developed there, by the way, by my sister, which is fantastic, I would say, occupational therapy. And, well, we don't discriminate here. We just take everybody, what is the best, and then we try to come up with idea to help those patients. First, of course, to give them knowledge, that I think is important. But most important, to work in their self-esteem, self-confidence. There's 2 points. That was the basis for the autonomy. And we do have a lot of data showing that patients that are resilient, patients that have self-esteem, they do better, whatever they do. But that's even not for patients with epilepsy, for everybody. How many toxic relationships the people have because have a low social self-esteem. So we have to build this up. So there's a way to build this up. So we can develop it as a program specifically for this that we call newly diagnosed epilepsy reception group, which is terrible for English speaking actually, because in Portuguese we have a word called acolhimento, which is far more than reception. Is not well in the sense of welcome, is not refuge, it's kind of something in between. That, but I leave this as because it's the first time we are showing this because we just finalized a pilot project and that it was conducted from April to June last week. So that we can show you some interesting results that we invite people to participate. Is interesting. People sometimes they don't show. This is a common phenomenon everywhere. So we end up having 6 participants, 2 patients that is adolescent with epilepsy, and 2 family members, usually mothers. Father seems to be non-existent in this kind of thing. And 2 support team members, which are also young people without epilepsy, which we think is very interesting also. And then because of a kind of, we want to know what about this STEM, we did a lot of questionnaire to get the things. And the first session we call letter of desire, because we're asking everyone to write what would they desire most, and have the seal, and actually we ask them to open in the end of the program to see what they desire. Will actually they deserve that, what they desire. Sometimes people feel that they are not worthy. And so we explain again that we want to improve the knowledge and to help them and have self-esteem, self-confidence that might lead to autonomy. And here is Alessandra, mother of patient Breno, that said, well, this is very important to me, thank you all. The second session, that we deal with the mandala of emotion, the particular approach as I mentioned. And the comment is that our emotion can be controlled through mandala and give good energy. One of the participants said, I learned to stop, breathe and renew my emotion, trying to lighten the burden. And then we have self-esteem for exercise. And then we also have a Shan Kong, Ding Ding, I probably know of that, is a Chinese type of exercise that they said to bring a perfume. Well, I never got a chance to have that, perhaps not that good practitioner, but that was very well taken, particularly by the patient's youngster, because that did have a physical component on that. So that is an interesting point. Social skills, we try to train them. And at the closing, we also have some perspective on the safe environment through the eyes of occupational therapy. And the comment is that we are very happy to be part of this group. I'm sure I was unforgettable learning experience will not be just in theory, and because we know the importance of the mind of the body and control of emotions. And this one, I want to just highlight this, which is great. It's that because that will lead us to the rest of our life. We are finalizing, so this I think is a way perhaps can probe more. I invite you everyone to perhaps to have a look on your own environment to see how you can actually improve self-esteem and self-confidence. As for employability, this is a systematic review that my student is carrying out, but I want to take this. What is the top 15 quality and skilled employer are looking for 2019? Well, there's a hard skill. You have to know the thing. Like if you want to program a computer, you know how to program a computer. But there are the soft skills, something that is not quantifiable attribute that cannot be proven. Okay, is that hidden quality. And yes, 2 days ago, Francesca Sofia talked about the IB Academy for Persons with Epilepsy. I would say that have to be a both way. It's not only teach people with epilepsy, but people with epilepsy really can teach us a lot. And I learn a lot from people with epilepsy over the years. And this is particularly quite clear by what Philippe Gattoni showed in the storytelling. All those powerful stories, all those stories of overcoming the difficulties. And this is the yin yang is that we've been ages on the dark side, talking about bad things, bad thing. It's about time to change the tides. Let's bring what is good in the person with epilepsy. So whoever took the note of those 3 words I asked, nobody took? Okay, I remember resilience. What else? flexibility.
Stress management.
What?
Stress management.
Stress management. I can say that people with epilepsy eat this for breakfast. Eat this for breakfast. No? It's stress management. They deal with a situation of unpredictability.
That's true.
They cannot predict, even though they survive. When they have a seizure, back to the bone, they have to raise up and keep moving. Isn't that resilience enough? So I think we have to start to bring this up for the soft quality. And us, for instance, let's take what's going on in the US. Because a lot of a veteran that's going home, there's no job. And then there's a movement towards to changing that. Here is the Amazon. We actively seek leaders who can invent, think big, have bias for action and deliver results on behalf of our customers. This principle looks very familiar to men and women who have served our country in the armed force. And we find their experience leading people is invaluable in our fast-paced work environment. Jeff Bezos. So we have to start to rewrite the history here. No longer self-pity, but what is great about people with epilepsy. So it had to be in your resume, not hiding, but epilepsy taught me to be hard, not quitter. Okay? I'm disciplined. This should come up and should value. And then I finished, and like Forrest Gump said, life is full of a box of chocolate. And the point is that you only die once. You only die once. You die once only. But you can live many lives. You can live many different lives. You have a bad life, it's time for you to change this. Let's change for a better life. Take a shot. Thank you very much.
Thank you, Li Min. Can I ask the other presenters to come up to the table, please? And we've got about five minutes or so for some questions.
Just to follow up on what you were saying about the employment, because I obviously grew up with epilepsy, and when following on from school and college, we had the Disability Discrimination Act and then the Equalities Act later on back in England. But I felt the need to actually go out there and advertise my epilepsy rather than try and hide it when I was going out to interviews, and I was actually going out there and writing to employers, and rather than trying to wait for adverts, and I was advertising myself and talking about the epilepsy, and it, that came up chunks, and I got work at British Telecom and built a career with them, and as a result, next month I should be getting my 30-year certificate from them.
I've got a question for Michelle. I was wondering, do you go into early childhood services as well as schools?
Yes, 100%. So we show videos of what different seizures look like. And now that you mentioned that, ironically, it's often educators that notice absent seizures, and they'll say to the parents, your child's ignoring, your child's daydreaming in class. And so sometimes that triggers the conversation around absent seizures, but we 100% cover all seizure types in the teacher educations and the classroom presentations.
Yeah, so like with little kids as well?
Yes, so we, if it's a kindergarten class,
Yeah.
it's a different approach. So we take a life-size puppet, and like about to my waist, and we show them what different seizures look like. And we don't get into the terminology like we do in the grade 5 program, but we tell them in an age-appropriate manner.
Yeah, because
Yeah.
I'm a kindergarten teacher myself, and I have epilepsy myself.
Yep.
And we've got a few children in our service who are on midazolam, and they've been trained with that, but they still freak out
I know.
and come to me. And it's just like, I wonder if you go in regularly or update them along, little bits, to help them out as well.
Yeah, sure. Yeah, for sure. So I agree with you. We do have difficulties in schools right now around administration of rescue medication, if that's what you're referring to. Yeah, thank you.
Can I just follow up on rescue medication? This is very important in education, especially in schools. Even not only in schools, but also in homes, having a lot of problems. Prolonged seizures, if they're not properly handled, the patient can die or the patient can have brain damage because of the status of the seizures. Although it's not mandatory that the teacher should administer medication, but the emphasis should be really put to the teachers that when a child is having status epilepticus, something must be done. Because if you start visiting around, calling the ambulance, calling the doctor, that time lapse can bring a lot of problems to the child. So emphasis must be done. There is what we call rectal diazepam. In countries where there's rectal diazepam, teachers can be taught, mothers can be taught how to administer rectal diazepam and save the life of the child.
Yeah. And we do, if you take a look, the video that Dr. Andrea Andrade created for us, or collaborated with us to create, talks about the implications of not administering medication immediately. And the danger to the child.
Exactly.
So yeah, we are working as an agency and as a province to change that and make medication mandatory, administration of medication.
That's it.
So I 100% agree with you.
I support that. I'm a clinician and I
Okay.
treat thousands and thousands of patients. You find that when a patient is having status epilepticus, and many of them have died, many of them they have brain damage, many of them have got a lot of complications because of the delay. It doesn't make sense when the patient is having status epilepticus to lift the child and put it in a car and start driving. That makes sense. You deal with it right there and you save life.
Agreed. Yeah. Thank you for your comment.
Yes, thank you very much. As like our friend from Gambia already said, I also had my 30th year of employment in the same company. This year, this November, sorry, it's a little bit later than you. I never hidden my epilepsy in front of anybody, so that's why I'm here, and that's why I'm worried, because this huge hall is so empty. Although I know there are hundreds and hundreds of attendances here, unfortunately they don't hear the voices. So it's really, how do we bring this nice session to everybody? This is in my opinion, the most important task. How do we get the material available for everybody? As I pointed out yesterday with Mary Secker, it's a nice program which could be replicated all over the world, but there's no access to it. The same goes for Professor Lee Min Lee's story about the employment. I could go on with everybody on the floor, but we need something like an upload tool where everyone can download it and make it accessible everywhere.
Thank you, Michael. I can let you know that the IBE is working on a project to create a online portal where we can put the best the IBE members.
I just want to congratulate everybody. That was a phenomenal session. Engaging, interesting, focused on the person with epilepsy. So I'm going to ask my question to one person, but it's not to diminish the value of the other contributors. Dr. Lee, are you a neurologist?
Yes, I am.
Okay, here's my question. I just think you did an amazing talk, and I'd love you to be my neurologist if I needed one and I lived in Brazil. Now, do you change the way you approach epilepsy in a clinical appointment, knowing in how you care for your patients, knowing the importance of what you talked about?
Yes, actually, I was training in neurology and also PhD in McGill with the Andamas, and I went back to Brazil, where I started interacting with a lay association. That was a real game changer. I would like to perhaps touch a little bit what the colleague mentioned about the room not being full.
Yes.
Is in the sense that knowledge does not go necessarily together with the people buying the cause. So the people here mostly they have the cause of epilepsy. They want to fight for a cause. So we need somehow to get an inception of the idea that they can start to see the other side. So by working with the lay association, with the patients, then I start to also have a different views of what's going on, not only because there's a gene problem or because of this medication or that, which is all important. But I think more important, perhaps when you ask the patient what the trouble is not the disease itself, it's the stigma on that. So I do see a lot of this, and not many neurologists, share this aspect. But I think more and more is moving. Sorry to be long in the answer. I was 8 years ago was a conference in Rome. I was one of the keynote speakers in the presidential session. There was only me and the other speaker, and the parent chair. Even the EOI president arrived later on and then was empty. But now I'm very happy that I'm more people. Even though it's a long way to go. So don't get desperate or.
I'm very sorry. Because of the time, we have to close this session. But it's up to you. You can stay here and talk and change experience. But we have to stop the session now. Thank you very much.